If surgery is part of your thyroid cancer plan, here is what actually happens, step by step. Thyroidectomy is the removal of part or all of the thyroid, a small butterfly-shaped gland at the base of the neck. Surgeons choose between removing one lobe, called a lobectomy, or the whole gland, called a total thyroidectomy. The choice depends on tumor size, cancer type, whether lymph nodes are involved, and your overall health. Before surgery, you'll have blood tests, a neck ultrasound, and a quick check of your vocal cord movement. The operation happens under general anesthesia. You are fully asleep and feel nothing during the 2 to 4 hour procedure. The surgeon makes a small horizontal cut in a natural skin crease at the front of the lower neck. The surgeon carefully protects the voice nerves and the tiny parathyroid glands that control calcium, then removes the thyroid. If cancer has spread to nearby lymph nodes, those are removed too, in a step called neck dissection. Most people stay in hospital 1 to 3 nights. Neck soreness, mild swelling, and a hoarse voice are common at first. At home, most people return to light activity within days and office work within 1 to 2 weeks. After a total thyroidectomy, a daily thyroid hormone tablet simply replaces what your body used to make. Risks include temporary hoarseness, low calcium, and rarely bleeding. Experienced surgeons keep these risks low. Follow-up includes regular blood tests and neck ultrasounds, more often at first, then spaced further apart over time. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.